Hollywood calls it the double chin killer. Its real name, Kybella, an FDA-approved injection that can eliminate fat cells under the jaw.
I don't know. Double chin killer works for me. Dr. Purvisha Patel from Advanced Dermatology is a provider of Kybella in Memphis. She's here with patient Melissa Spear, who's had this procedure. Thank you for coming in. In a nutshell, what's Kybella?
Kybella is deoxycholic acid, which is a bile salt that actually makes the fat cells where it's injected kind of explode and go away. So it's been FDA approved for the submental area and helps reduce that, the little bit of fat that can accumulate, and that's generally mostly genetic in most people.
I'm wondering, doctor, can most of us get this or have it, or maybe we just don't see it yet, or what's the case?
The neck, a lot of it's genetic. I would say 50% is genetic. Some people will gain weight and lose weight, and it can be a little bit more noticeable.
Gotcha.
And it really depends on what's bothering the person. For example, people with thyroid disease tend to have thicker necks anyway, and that's not due to the fat that's there.
Gotcha.
This product is indicated for injection into the fat to decrease that.
Interesting.
Okay, so Melissa.
Yes.
Painful?
It is done with injections, but it's a very small needle.
Okay.
And it numbs pretty quickly. You can be numb beforehand. I wasn't, and it really wasn't that uncomfortable.
Okay.
And it had a little bit of swelling post-op and a little redness for a couple of days, and then swelling for about a week.
And how noticeable was the difference for you?
You know, for me, I had lost a lot of weight. I had lost about 100 pounds, and this was an area that bothered me more than anything.
Because it was sagging?
Because it was.
Yeah.
And a lot of people, you know, had said, what did you do different? They knew I'd lost the weight, but then they noticed a change.
Yeah.
And then a couple of people have said, what did you do to your neck?
And that's kind of what you want.
Exactly. So, Melissa, I'm wondering, how quickly did you see this transformation actually take place?
Mine kicked in at about 4 weeks. So most people, I think it takes longer.
Yeah.
And what was your reaction? I mean, I know you got a lot of other people notice, but what did you say to yourself, and how pleased were you?
I was extremely pleased. It was well worth it. And it wasn't what I call that uncomfortable that I would do it again in a heartbeat.
And that's a good question. Do you have to do it again? How long does it last?
So that's a great question. This would be considered permanent reduction in the fat in the area that actually goes away. Now, some people may want to get another treatment or have a little bit more injected to where they think that's cosmetically appropriate for them.
Right.
New studies about Kybella actually have shown that there's concern that if you have loose skin and then you inject the fat, will you just end up having a lot of loose skin?
Right.
And some of the new studies that are coming out with Kybella are showing that it's actually tightening the skin with the fibrosis of the fat going away as well.
Doctor, I'm also wondering, what about men? Are they doing this as well?
Absolutely.
What are you saying, what are you hearing?
Yeah, no, absolutely. I think most people who are concerned about this, look, there was nothing available on the market at this point unless people went through a pretty, a neck lift or something that was pretty invasive. And so we've now got this new technology on the market for this area.
And you don't get that I had work look.
Not at all.
Because, you want it to be subtle. Okay, can you do anything for the thighs?
That's a great question. It's not indicated for the thighs. There are a few machines out there for cellulite of the thighs. One in particular is something called Selfina, which will actually go in and we subsize the fibrous bands that cause the dimpling. And then there are some more indications and transducers for the Ulthera machine, etc., for the body that are coming out. So the science is constantly evolving, and I think it's just kind of our job to let everyone know what's available.
Doing just that. Thank you very much.
You look
appreciate it. Good to see you both.
Thanks for having us.
Well, come